So why do we need biomedical informatics and health information technology? Much of the push for the solutions developed by biomedical informatics are supported by the 2001 Institute of Medicine report, Crossing the Quality Chasm. This landmark report emphasized that healthcare today harms too frequently and routinely fails to deliver its potential benefits. In short, they said, between the healthcare we have and the care we could have lies not just a gap, but a chasm. In the report's chapter, Preparing the Workforce, there's an outline of the types of new or enhanced skills required by health professionals to function in the changing environment. These skills can be grouped under 5 main topical headings: patient-centered care, evidence-based practice, informatics, interdisciplinary teams, and quality improvement. These areas should sound familiar to you. It's no coincidence that they form the backbone of our NYU 3T curriculum. Informatics, the tools to communicate, manage knowledge, and support decision-making using clinical information. Interdisciplinary teams, the cooperation, coordination, and communication and standardization of you working in teams, making care more patient-centered, continuous, and reliable. Evidence-based practice, the integration of the best and most current research coupled with clinical expertise and patient values. Patient-centered care, informing and involving patients and their family in medical decision-making and self-management. And quality improvement, overall improvements to our care as individual practitioners, groups, and systems. We know that informatics solutions are growing throughout healthcare. Things like the electronic medical record, decision support and reminder systems, telemedicine and teleradiology. All of these tools are being used increasingly throughout all healthcare centers. And why is this? Well, we know that the United States healthcare system is the world's largest and most inefficient information enterprise. We're also pushing towards increasingly integrated healthcare teams. We deliver better care that way. We're increasingly emphasizing the care of chronic illnesses and chronic diseases such as diabetes or congestive heart failure. And these diseases are particularly suited to the use of information technology since they rely on temporal tracking of quantified data such as the hemoglobin A1C. And of course, we as providers, as hospitals and as healthcare systems have increasing reporting requirements. Things like insurance companies pay for performance, which are new initiatives that will actually pay nurses and physicians more or less money depending on the quality that they deliver, and quality assurance. But perhaps most importantly, we know that the cost of information handling, the cost of managing all of the paper and data of patient care is about 25% of the total hospital operating cost. This is a huge amount of money. And we know that the percent of time that we spend working on information handling varies depending on role, but for professionals, nurses and physicians, we spend about 1/3 of our time in such activities every day. Across all employees, that's about 25% of the time. That means that in general, we will spend about 1/3 of our time working on electronic medical records or physician order entry systems or nurse order entry systems. And having competencies and skills within these systems is of intense importance because of this level of use. As we show you throughout this module, we know that health information technology has the potential to transform healthcare by reducing medical errors, by improving overall health, by saving us time and money, and of course by improving our health professions' education, such as through technologies like this. But so far, all of these wonderful advances have done little to actually change clinical outcomes when we measure them on the entire population level. Most of the care in this country is still delivered on paper. And that's because most of the visits in this country are in the clinic, where there are fewer electronic medical record systems. So that means that most clinical visits are not aided by the wonderful tools such as decision support or reminders, which help nurses and physicians make the proper medical decisions, deliver recommended care without having to remember it all, and prevent them from making medical mistakes.